Why are Schwartz Center rounds so successful? You are listening to ReachMD XM 157, the channel for medical professionals. Welcome to the Clinicians Roundtable. I'm Susan Dolan, your host, and with me is Dr. Thomas Lynch, professor of medicine at Harvard Medical School and chief of Hematology-Oncology at the Massachusetts General Hospital Cancer Center in Boston, Massachusetts. Dr. Lynch, welcome to the Clinicians Roundtable.
Thank you very much for having me.
Tell us, what are Schwartz Center rounds?
Schwartz Center rounds are an opportunity for clinicians to get together and talk about the types of things which there really is no other place to talk about, the non-clinical aspects of patient care. They're sessions where cases are presented by doctors, nurses, social workers, chaplains, and we talk about what the case implies, what kinds of feelings it brings up within the clinician, within the caregiver, and how this impacts the work that we do.
What feedback have you received from physicians about these rounds?
I think the greatest thing about the rounds, and we started the rounds here at the Mass General Hospital in collaboration with the Schwartz Center about 10 years ago now, so we're now in our 11th year of doing Schwartz rounds, and I hear several themes that I get when I talk to my colleagues about why they come to rounds. One of the things I found so remarkable is how well attended the rounds are. That 10 years into this, we are still getting 100, 150 doctors every single week. Not only doctors, but doctors, nurses, social workers, and clergy who come every single month to talk about the topics that come up in the rounds. I think, first of all, you get increased insight into the non-clinical aspects of patient care. So much of what we do as caregivers is outside of the standard physiology that we learn in medical school. And so much of what makes medicine a unique job is that connection that you get with people and with patients. That makes it a different job than being a technician or being an engineer or being somebody who's involved in the biomedical industry where you don't get connections with patients. I think that the rounds give us a place to park those kinds of feelings and those kinds of emotions. My dad is a hematologist who retired approximately 10, 15 years ago, and I remember as a kid, my dad would talk about, every day he'd talk about what lunch was like at the hospital. And one of the interesting things is all the docs would get together and they'd have lunch together, and they would sit at a big table, and 10 or 15 docs in the hospital would sit down and just unwind and talk about their days and support each other in their days. And that doesn't happen anymore. I mean, we're too busy now. Nobody has lunch with anyone else. There is no more doctor's dining room at a hospital the way there was 30 years ago. So we don't have the kind of support structures. Plus, when you think about doctors who work in primary care now, they're not hospital-based. They're based in their office, their clinic, and they don't have the kind of hospital support structure that they used to have. And so Schwartz Center rounds certainly doesn't replace that, but it's one effort to try to meet that need to give doctors and nurses a place to park these kinds of discussions that they just don't have any other place to park. I think another key thing is the concept of teamwork and how this allows us to work better in teams. I think that the Schwartz Center actually convened an important survey done by an independent research firm to question people who went to rounds and to ask them what really made a difference. And teamwork was one of the most important topics that was highlighted. The concept that caregivers realize that they're not practicing in a vacuum, that secretaries find out that some of the same worries that they have about how a patient's doing or how a family's coping is shared by a physician. It allows teams to function better and allows for there to be a more level playing field among the different caregivers who participate in clinical care. I also think it leads to a much more supportive environment in the workplace, which I think is good. We also work to try to increase the mutual respect level, I think, that we get between different caregivers, between nurses and doctors and secretaries and pharmacists and physical therapists, that we gain more insight and appreciation of what each of us does. I mean, recently we had a patient presented at Schwartz Center rounds where there were significant genetic counseling issues, where young people were finding out that they had a predilection to developing certain types of very difficult and untreatable cancers. And learning exactly what the genetic counselor did and really what he or she felt was really incredibly dramatic and very powerful for helping us create a better sense of team.
How much time do they take?
Rounds are now done at over 130 hospitals around the country, And they've evolved a little bit differently, and so some rounds are 90 minutes and some are 45, but I would say probably 90% of them are an hour. And they're usually held at lunchtime, but many places hold them at breakfast and some hold them in late in the afternoon. There's usually a meal served with Schwartz rounds, which I think adds to the supportive and nurturing aspect of the rounds themselves. And we find that an hour is just about right. It takes about 15 minutes to present the case in detail, and that leaves for a nice 45-minute period for a focused discussion.
How many clinicians do you guesstimate are participating in Schwartz Center rounds at the 130 sites?
It's actually 140 sites in 27 states. We have actually looked at this, and we think there are about 27,000 clinicians every year who participate in Schwartz rounds. And as I said, many of them are physicians, many are nurses, many are physical therapists, social workers, clergy, pharmacists, research personnel. It's an incredibly diverse group.
How can a healthcare facility start Schwartz Center rounds?
So the way that we find makes the most sense is to contact the Schwartz Center and talk to our Director of Programming, Marjorie Stansler. And Marjorie provides the information necessary to start Schwartz rounds. We actually have a kit that we send out that describes the process and that helps groups get Schwartz rounds off the ground.
If you're just joining us, you're listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. I'm Susan Dolan, your host, and joining me is Dr. Thomas Lynch, professor of medicine at Harvard Medical School, discussing Schwartz Center rounds. Dr. Lynch, give us an example of a rounds discussion.
We have a rounds discussion that we're planning for this week, and we plan to have a discussion about what it's like to be a patient on an experimental clinical trial and trying to give insight to caregivers about the patient's perspective about clinical trials. And I think one of the key things to note that Schwartz rounds are different from ethics rounds is that ethics rounds tend to have very formal constructs that are involved in the way the ethics rounds are functioned. We're not really focusing on the ethics of a clinical trial or what needs to be done to effectively protect a patient's rights in a clinical trial. Those are incredibly important topics, don't get me wrong. What we really want to know about in the Schwartz Center is how does participation in the clinical trial impact the caregiver-patient relationship and the interaction between the patient and the caregiver. And that's what we're focused on promoting and delving into and discovering as part of the Schwartz Center round. So in this round that's coming up, we will have the patient case presented by one of the physicians who will talk about Mrs. Jones, and we'll talk about what her cancer is, and we'll talk about the clinical trial that she went on. And then we will have the nurse who takes care of her and the social worker talk about some unique problems that she's had while in the clinical trial, what it's like to find out that you're responding to an experimental agent, and what it's like to find out that the person who was your buddy, who you went through treatment with, isn't responding to the clinical trial. And we'll talk about sort of how we relate to that, what that makes us feel, how that might make us be more sensitive to other patients in the future. And so that's the sort of structure of the rounds that we're planning for this week.
What led to your passion for Schwartz Center rounds?
Well, I started off as Ken Schwartz's physician. So I had the pleasure of knowing Ken, and I really understand and feel the passion that he had for his cause. And Ken Schwartz was a 40-year-old man who developed metastatic lung cancer, not a smoker, no prior health problems, and he developed cancer that had spread through his body. And Ken at that point felt that despite everything his doctors and nurses were doing for him, despite the fact that they weren't shrinking the tumor, he still very much felt cared for. And Ken wrote an article in the Boston Globe which described his experience and described the importance of connection between patients and caregivers. Now, Ken also happened to be a healthcare attorney who very much worried about what the future of healthcare was going to be. As you know, in the mid-'90s, there was a lot of concern that we'd be moving toward a system where healthcare plans were capitated in terms of their expenditures, and we would have a capitated system. And one of the things that Ken very much worried about is that we would lose the human connection in healthcare if this occurred. Well, it didn't occur, yet many of the fears that Ken had, I think, have been realized. I mean, doctors now are forced to see patients faster than they ever have before. Reimbursements have not kept up with inflation. primary care doctors have paperwork burdens and have responsibilities put on them that are unknowable by prior generations. When I talked to my father and his friends about what medicine was like 40 years ago, the climate of practice for a physician was so much better than it is now in terms of what we have in terms of administrative and bureaucratic nightmares. The idea of needing to call pharmacies for pharmacy pre-approvals and getting wheelchairs approved by patients after filling out 6 forms. This was something doctors didn't have to do before, and they could spend more time focused on patients rather than dealing with bureaucracy. And I think one of the things that Ken's work does and what the Schwartz Center does, it says, listen, we know there's increased bureaucracy now. We know that the quality of the job is different than it was 40 years ago. But the reason people go into medicine is still not a heck of a lot different. Is they go into medicine because they enjoy dealing with people, because they feel a connection to people, and they want to ultimately help people and help people out in difficult times. And I think that's one of the passions that Ken identified within his caregivers, and one of the things the Schwartz Center tries to promote.
What feedback are you receiving from patients?
Sometimes we have patients participate in Schwartz rounds, and they come to Schwartz rounds and present cases and present their case and talk about what it's like to be a patient. You know, one of the things the Schwartz Center has tried to do is try to focus a little bit this year on the patient part of the caregiver-patient relationship. And this year we have a patient initiative that we're developing where we are working with patients on, and we're asking them what makes a connection work for you within this relationship. And so we're finding this to be very effective as well as a way to go forward.
Dr. Lynch, what's your take-home message?
Take-home message is that what made medicine meaningful for the prior generation of physicians, what makes medicine meaningful for me and what will hopefully make medicine meaningful for the next generation of physicians, is that it is fundamentally a human science. And that fundamentally when you ask yourself, why do you enjoy getting up in the morning and going to work, it's because you know you're going to be interacting with people who you care about and who care about what you can bring to them and how you can help them. And that connection with patients is missing in so many other parts of our society, that human person-to-person connection. And I think it's one of the things that makes medicine such a privilege to be able to do as a profession. And I think the Schwartz Center is working really hard to promote this and to remind caregivers and to bring them back into the moment and to remind them of that importance of what they're doing for people. And I think that's making a great difference in patient care.
Dr. Lynch, it's been a pleasure. Thank you so much for joining us to discuss Schwartz Center rounds.
Thank you.
I'm Susan Dolan. You've been listening to the Clinicians Roundtable on ReachMD XM 157, the channel for medical professionals. We welcome your comments and questions at reachmd.com, which now features on-demand podcasts of the ReachMD library. Thank you for listening.